The FDA considers this month's accelerated approval of the new drug a breakthrough in the treatment of Alzheimer's. Now, it is a drug that does slow the progression of cognitive decline in early stage cases. But some in the medical community, they're critical of the FDA approval, maintaining it needs to be studied more because the risks outweigh the benefits. Clinical trials involving almost 1,800 people with early stage Alzheimer's, the drug known as lecanemab targeted a protein in the brain known as amyloid, thought to be the most toxic brain cells, suspected as the main cause of the disease.
This particular medication dissolves the amyloid plaque and slows down the cognitive decline.
Dr. Manisha Parulakar, director of Hackensack Medical Center's Center for Memory Loss and Brain Health, feels this is a milestone advance in efforts to control the progression of Alzheimer's.
The impact this medication is showing is helping improve 40%, which is a pretty big number, and it is helping for a longer period, 18 months.
I don't believe that it should have been approved because there is suspicion that the antibody weakens blood vessels in the brain. This has to be further studied.
A number in the medical community agree. They question whether the benefits outweigh the risks.
The antibody may weaken blood vessels in the brain as it attacks these amyloid plaques and may cause hemorrhaging in patients.
Critics foster their argument by citing reports of at least 3 recent deaths of people involved in Phase 3 of the clinical trials. The FDA responded to our inquiry, noting in a statement, patient deaths are not uncommon in clinical trials, but it is important to note that patients with Alzheimer's disease tend to be older, with many of them having pre-existing health conditions that may factor into the medical outcome. The FDA also told us the agency stands by its approval of the drug and that the agency has carefully reviewed the data and determined that the benefits of the drug outweigh the risks.
If we do careful patient selection and if we monitor them closely, it does look like the benefits are better than the risk.
Whether or not this drug actually can have a significant impact on slowing cognitive decline still needs to be further evaluated.
Now, that particular drug, it has to be administered by injection every 2 weeks, and I have to tell you, it's quite costly, more than $20,000 a year for treatment. Medicaid, Medicare, health insurance carriers, they're all still reviewing whether or not to provide coverage. Despite all the drawbacks, researchers feel the new drug at least gives them hope that this is just one more step closer to eventually finding a cure for Alzheimer's.